Hello, this is Dr. Bouvier with Dr. Yu, and you came to this video to learn a little bit more about home health care and the components that make home health care successful. So the first component is you have to have a good caregiver. Have to have somebody who is there in the home, not 24/7, but available at least a couple times a day to take care of things. The next component is good transportation. I'm going to give you an example of transportation and why that's important on each one of them. Then the third thing is you got to have good physician slash provider or providers backup. Things being mobile, it's important that we have that. The providers being like lab, x-ray, durable medical equipment, making sure that we can do vascular things, but those are the providers. Physicians, the nurse practitioners, the doctors that can come in and take care of a place. The fourth component, there's a lot of components that people don't like to talk about, but it's absolutely necessary to be able to take care of successful outpatient home health care, take care of somebody in their home or in an extended care facility or their apartment, etc. And the last part, the fourth component there, is somebody has to pay for things insurance does not pay for. Health care is over here, insurance care is over here, and the two rarely meet. So there's parts of health care like telemedicine and mobile integrated health that need to be paid for, but today, insurance doesn't pay for that. So I'll give you an example of a good caregiver when you can trust them to get their medications right, because medication reconciliation is incredibly important. The caregiver plays a vital role in communication, taking blood pressure, making sure that the I's are being dotted, T's are being crossed for the patient's care. And these are very simple things to be able to do. So it really takes a simple caregiver. I can give you further examples of that. Just give me a call at Dr. and You, or call me on my cell, 810-610-7972, 810-610-7972. Transportation is very important. Spontaneous transportation when they need to go see their doctor or a specialist or get out, etc. Transportation is very important. It's one of the major four things. Next thing is good physician and provider backup. And the last thing is people have to pay for things that insurance doesn't pay for. An example would be, and this is a classic example, is copays. Copays on a drug that is found to be very, very good for this patient, but there's a $70 copay, and most patients aren't going to pay anything over 25, so it makes it very difficult. Maybe 20% of the population will pay whatever it takes, but most people don't have the means to do that. So if you have one of those four components missing, it makes it very difficult for everybody else, especially the providers and the caregivers, to take care of that patient. You take away two of those components, it's impossible for that patient to stay wherever they're at. They have to go into a nursing home or back in the hospital. If you look, and I've done numerous studies on this personally myself, and I've got 30 years of experience doing this, if you take away those two, it costs the insurance company millions and millions more dollars than what it actually has to. So just kind of keep that in mind, Mr. Insurance Company, or Miss Insurance Company. If you just take away one, it's still very difficult to be able to take care of that person as an outpatient. So the four things again are good caregiver, transportation, number two. Number three is good physician provider backup. Number three is somebody to pay for things where insurance company doesn't pay for it. Again, this is Dr. Robert Bouvier with Dr. and You. You can get a hold of me at 810-610-7972, 810-610-7972. Thank you very much.